Well, good afternoon again. Welcome to the next grad chat here at OSU-Tulsa. My name is Kathy Williams, and as you've met me before and have been hosting these grad chats now for a couple of weeks, and I'm really excited today to have the guests with us that we have to talk about community and behavioral health. Because as you can see here, I was actually in the human services field for quite so many years. Just to let you know, a few housekeeping ideas and helpful hints for you as we get started. Sorry, working two computers here. Nothing like live TV. Please mute your mics, and we will have a question and answer series after each speaker is done. And just use the chat comments for questions, and you can just click that little speech bubble for the chat box. We will be recording this and sending it out to those of you who registered, and we will also be doing our Facebook Live. So please feel free to join us for those Q&A sessions after we're done. One more thing here is one of the reasons that we are talking to a lot of these professors the last couple of weeks is why are the graduate degree at all? Because it opens more employment opportunities. A lot of the careers, especially the ones that we're going to be talking about today, require a master's degree or higher. And this demonstrates to those employers the ability to complete a long-term project, and it helps to accelerate your career or even take a completely different career path, and gives you much better negotiating power for salary and benefits, and hopefully greater lifetime earnings as well. So today, I'd like to introduce our first guest, and it's Dr. Randy Hubach with the Masters of Public Health and our Center for Health Sciences and the Rural Health Center.
Yes, exactly.
Welcome.
Thank you for having me. I really appreciate it.
Well, tell us a little bit about your background, Randy, if you would, please.
Sure. So my background, kind of going to your point, is I did not study in the area of public health. My undergrad was actually in history and political science and the like. But I really grew this passion for working with underserved and marginalized populations. So I've been working in the field for 15 years, and I have a Master's of Public Health from out in California, and I did my PhD at Indiana University. And during those times, I've had opportunities to work at local and federal governments like the CDC, but also local and state health departments too.
So what was the switch for you? Because that sounds like a pretty big transition there from one career to another.
In the beginning, it was part of it was the early 2000s, and not everybody was looking for a history major to hire. But I had my first job working for a community-based organization that was developing programs for emerging adults, and it kind of ignited a passion about what could we be doing to better the health and well-being of our communities and individuals within it. And so that kind of led to a transition to where I enjoyed doing the research part of it and working with agencies, and wanted that trajectory so we could train future individuals to do that too.
So go back just a little bit in your statements there and talk a little bit more about, it ignited that passion in helping our communities, and especially, I guess, in rural and underserved areas.
Yeah, so our program, I think all the programs you're going to hear from today, I think one of the things that we're grounded in is this idea of social justice, that we're really here to better individuals, communities, and create policies that benefit the well-being of Oklahomans and those in communities outside of our state. And so for myself, it was not even at that point rural underserved communities. It was, what are the needs of the people that I live around with? Because we are members of those communities. And by doing so, I started to see, well, we need better infrastructure. We need policies that treat individuals equitable. We see disparities in health based on where we live or how educated we are. And addressing those social factors is a way that the MPH program kind of prepares students to say, well, how can we go back and serve our communities to better health?
So I'm going to ask you to dive a little bit deeper into that. How exactly does that program help those communities and those people that you just mentioned?
So the MPH program really is also about service learning and engaging with the community too. So a lot of our students through their practicum or their thesis are going to be working with community-based organizations.
Such as?
So we have Tulsa Cares, which works with HIV organizations here within Tulsa. We have individuals that work within food and nutritional clinics, students that have worked for the state health department to try to craft policy that could be then informed future interventions. They're also working with tribal nations. So OSU now has the first joint med school with the Cherokee Nation. And so that's,
yes.
We're putting a lot of effort to serve and work in hand with the tribal communities within our state too.
That's fantastic. I mean, it sounds like there's just so many different avenues that a student can take with this degree. Would you say that this degree is more research-based, or is it actually hands-on, or both?
It's the degree can be what you want it to be. It's mainly applied as a professional degree as within the field of public health. This is the degree that most agencies are looking for, from governmental in the United States and outside the United States. Is widely recognized within the field of public health.
Why? I'm sorry to interrupt, but why is that? Why are this degree is what they're looking for? What are the components that this degree offers that those agencies are looking for?
Yeah, so all of when we think about a Master's of Public Health, the accrediting body is the Council on Education in Public Health, which accredits all public health degrees at the bachelor's, master's, and doctoral level. And so it's training you in the core functions of public health, from epidemiology, which is looking at disease prevalence, incidence. So if we think about if there's an outbreak, if we were to think back to Ebola, or if we think about salmonella poisoning, whatever we see on the news, those are those epidemiologists, which really are kind of these investigators that are going out and linking health outcomes back to what is the cause.
Not just putting the Band-Aid on the top of it, but going back to the root of it.
Going back for it. It's this idea of really about prevention. The degree also focuses on environmental health, so looking at what is being placed into our water, our soil, and the like. And then a lot of it's based on kind of that social justice aspect of how do we address these factors and determinants like education, housing, policy. How do these all then impact outcomes for the individuals and for our communities?
Without getting too political, but I like the term social justice. So can you tie that term back into Masters in Public Health? I mean, how did tie those together for us?
Yeah, we're teaching all individuals within the program to be a researcher, to understand, to question, to doubt, and to kind of seek those answers. We're also wanting those individuals to be advocates. I think we have to be advocates for our own health, but also advocates within our community. So that advocacy really is that social justice piece. It's just the seeing when identifying what could be better. And we're training individuals to be good practitioners. And when I think of practitioners, these are people that are implementing and developing programs or projects within our communities.
Such as what?
So we have individuals that have gone out into the community, and I have a student who's been working on developing sexual and reproductive health programs within rural areas. We've had individuals that have now gone into med school and are developing telehealth and telemedicine programs to where they're working with established physicians and then bringing care out to those underserved areas.
Underserved areas where that's where they can't necessarily get to the doctors.
Yeah, understanding
I've seen a lot of that on the news.
Yeah, within Oklahoma, we have 3 counties that have the highest premature death rates, that people are dying earlier than anybody else in the U.S. And so by looking at that, what's going on, is it the economics, is it access, the resources? It's really starting to evaluate what's the big picture.
I love what you're saying. I mean, I could just ask so many more questions about all these programs that you have to offer. So tell us a little bit about, first of all, before we get into the details on the program itself, talk to me about, you mentioned so many different directions and so many different, fields that these students can go into, but where are you getting your students from? Who's an ideal student or a candidate for the Masters in Public Health?
Yeah, we have students that come, quite a few that come from Oklahoma, but other from neighboring states all over the U.S. and internationally. We have students that are straight out from undergrad, those who maybe are a physician or a veterinarian who've been out in the field for many years that are coming back. So our population of students is quite diverse. Ideally, we're looking for individuals who have that passion and kind of that understanding of what are the needs of their community. Because that's going to be the driving force for you. So the program that we have can occur between 18 to 24 months. We have a lot of students that are professional working adults. The classes are in the evening. So a lot of people that are working maybe within schools or health departments. We really want to make sure that we can do that continuing education with all individuals, so you don't have to be 100% a student.
In seat.
Yes.
Right.
Yeah, and the classes are both in person, in Stillwater, but also in Tulsa, and then we have online options at the same time. So what we would like to see is individuals who either worked or volunteered within kind of the public health sector. So individuals who've maybe have been working with faith-based organizations addressing homelessness within our
The
community.
social issues.
The social issues.
Right.
And I think most of us, by just observation when you're driving, we're seeing what are some of those factors that are coming into play.
It's all too obvious.
Mm-hmm.
Yes.
It's very obvious, and these are the questions that maybe your undergraduate degree helps formulate it.
Speaking of which, what undergrad degrees are you looking at, or would you prefer as far as recommending to an undergrad student to get into if they want to go this direction?
Yeah, I think traditionally we start to see people that have come from some type of health science undergrad degree, or psychology, or sociology, but in reality, almost any degree will prepare you to be successful within the program. It's that life experience and what those core foundational aspects you've learned in undergrad can then be applied to from more of a public health setting.
Just depends on the direction you
Just
want
on
to
the
go.
directions.
And I can only imagine that with so many directions that you might have thought you were going this direction and get in and realize, wow, well, this, just like yourself, has ignited a passion for something else over here that you didn't even realize.
Yeah, and we've had a lot of students that do the MPH before they apply to medical school or
vice
PT
versa?
school or the like, and kind of vice versa. And for them, some individual has said, you know what, I thought I wanted to do X, Y, and Z, but in reality, maybe I want to go on to a PhD in public health. So I think a lot of us have these trajectories in our mind, but we know that they're fluid and they can change at any time.
And I can vouch for that myself. I've worked in this field, and then I ended up over here in higher ed, and you just continue that journey because it's just something that just clicks and fires, and you find that direction.
Exactly.
I noticed that that the GRE is required.
Yes. So we the GRE is required for the Master of Public Health. We also have a certificate in public health, which is all online. It's 5 classes that you could do, and with that, the GRE is waived.
Okay.
And so some students, what they'll do is actually start off with a certificate program, prove that they academically can meet the challenges of graduate school, and then they'll apply to the full MPH, and then the GR waive is for them.
I have talked with many faculty members up to this point as well that have started their own, graduate certificate programs, and they're very popular. It's a good way for people to transition back into the educational system when they're not quite sure if they want to make that full commitment yet.
Yeah, there's
So.
the health and behavioral health aspects within OSU have some great options, and there's lots of options that are still being created by some great colleagues.
Now, all of these are over at our CHS campus, correct? Or right around the corner from there?
Yes, so it'll be about 1.5 miles away from here. Some of those courses are actually here at OSU-Tulsa as well, and then in Stillwater.
So lots of options,
Lots
of
of
different venues. So you can do this. Anybody who's interested in adding to their career, maybe taking it a different direction, just as we've discussed. Is there anything else that you'd like to add about your program, about the Center for Rural Health?
Yeah, I think our focus is in rural and underserved populations, and that really, we think of almost every community they're underserved and marginalized in some type of way. And so what we're looking for and what we do is engaging future leaders and preparing those future leaders. So if you know that within yourself that your goal is to give back, is to change and to better the life and well-being of others, the MPH is a great option with many different directions from working in public, private, and other sectors.
And I know that we have some nonprofit certificates going on this campus as
Yeah,
well, and I can see where you could maybe stack some of those and getting.
Yeah, our students take usually 2 to 3 electives, and we encourage people to go ahead and kind of cluster those. Maybe it's around nutrition, maybe it's about maternal and child health, or about health policy. So whatever your niche is too, we're going to work with you to say how can we do a sub-focus within that as well.
This is really exciting. I know it's a fairly new program.
Yeah, it's been here for 6 years.
6 years.
So.
And have you seen a lot of growth so far?
We've had a lot of growth. We have cohorts, usually about 15 to 20 students that come in from all over the U.S. and the world. but we've had some great job placements for our students from working in local and federal government, working with the World Health Organization, going on to do a doctoral degree, and people who really just want to give back to Oklahoma and that are working for either hospitals or local government or developing their own programs.
Well, I'm certainly glad that we have a program like this available, and even more happy that you came in to share your knowledge and your information about this program with us, because I think that because it is such a new program, there's a lot of people that aren't aware of it, and the connection and how close it is just to right here downtown and to our campus here at OSU-Tulsa. So again, we thank you for being here, Dr. Hubach.
Thank you so much for having me.
Visit us again.
Thank you.
Very, very nice. Thank you again. Our next guest I would like to introduce, as we started talking about even maternal and some other mental health and social issues, is Dr. Karina Shreffler with the Applied Human Services and the HDFS, which we refer to HDFS as the Human Development and Family Sciences Program. So welcome, Karina Shreffler.
Thank you for having me.
You bet. So let's start off with your background. Tell me about yourself, what got you started in this program, and kind of take us on into the HDFS program as it is.
Sure. Well, so my background is actually in sociology. My bachelor's actually was from OSU, and it was my dream to actually come back and be a professor here once I finished my PhD. So I went off to Penn State for 5 years and finished up there in sociology, but was fortunate to have some assistantships in the Human Development and Family Science Department at Penn State while I was a graduate student. And so, really identified in some ways with the mission of HDFS, especially with focus on resilience and helping individuals meet their fullest potential in life. So for those who aren't familiar with HDFS, it's really a combination of both understanding healthy development across the lifespan, but also understanding that individuals live within certain systems, whether that's their families, their neighborhoods, their communities, or society more broadly, and understanding how to help families with communication and help them to help their family members in a way to be successful.
So just as we were talking to Dr. Hubach about the kind of bigger picture, then your focus is a little bit more on not just the individual, but the family unit within that community and how it's all affected together.
Yes, I would definitely agree with that. Much of one of the biggest theories that we draw from is actually a family systems perspective.
Explain that, please.
Well, I'm not teaching the course, but,
okay.
but it really is understanding that we're not just individuals surviving on our own here. We are living within a certain context, whether that's most closely our family members, and so if you're, for example, going to deliver an intervention, it's really beneficial if you're working not just with an individual within the family, but also family members that they're going to be living with, and so helping build those relationships is a way to help individuals.
So that's the whole "it takes a village" kind of approach,
exactly.
and taking a closer look at each person within that village.
Yes.
Okay. Well, very good. How about the emphasis that we have here on prevention to help individuals and families? Because I know that prevention is such a huge factor, rather than, as we discussed earlier, putting the Band-Aid on the outside. But how do we kind of nip this in the bud before the problem begins? How does that factor into it?
Yes, so a big emphasis in HDFS is an education and prevention focus. We do also talk about interventions after the fact and everything up through the policy level, but our students are provided both knowledge of development and family dynamics, but also some applied skills in working with families, to help help them draw on their own strengths and maximize those rather than, waiting too long.
And how about the resources? I understand, I know that we have a Center of Family Resilience right here on campus. Can you talk to me a little bit more about the family resilience and their national reputation of that?
Sure, I would say that's really the mission of our department here at OSU, is one focused on helping families to be resilient, which again is really the strength-based perspective. We do have the Center for Family Resilience here on the OSU-Tulsa campus, and the goal of the center is really to be this interface between the university kind of knowledge generation and resources that we have here with those in the community. And the center does a variety of different activities, whether that's biannual community health fairs, but they also work with community organizations to evaluate programs. So, for example, with youth services to identify how their intervention programs are effective with youth. Also, sex education that's delivered in Tulsa to determine if that's effective, or how you can improve the programs that are delivered.
So our Center for Family Resilience, is that mostly for individuals, the community, or is it or uses it more of a research tool?
I would say both.
Okay.
Most of the activities are really engaging with people who are working through nonprofit organizations in Tulsa to help them, whether it's evaluate the programs that they're offering or develop and offer new programs. Sometimes the Center for Family Resilience will administer the programs themselves, and other times they will kind of act as the evaluation arm. But it's really, helping the community resources that are already in place to benefit from having a university in Tulsa who can help with kind of the research side that they may need to show if a program is actually working or not, or how can we tweak it to make sure that it can
be more effective.
Yeah, exactly.
Okay. I know we've mentioned the word intervention quite a bit here, and I know that when I talk to students during a recruitment process, a lot of them they're looking for either to be a counselor or to be in like a nonprofit sector, or some of the outcome careers that HDFS leads to. Can you expound on that a little bit as I move forward here?
Sure. So I would say that our graduates of this master's program largely work in two different domains. And so one is kind of more practice-based, so and that may be in education or teaching. It may be in research or program delivery. But the other domain is this administration of nonprofit organizations, so those who go into leadership positions or development of programs that are delivered in different organizational types of roles where they're kind of creating and leading positions.
So that, like you just said, they're working as administrators or at the organizational level as opposed to the individual therapist or counselor.
Right. We certainly do have some who are working in a more applied delivery role, such as a parent education position, but our graduates are not certified as counselors or therapists. They're really more working in program leadership,
right,
program delivery at nonprofit organizations around Tulsa.
Okay, so there isn't necessarily a license or anything that has to be earned once you've finished your degree with the HDFS
Well, there are
program.
some options.
Okay.
We do have a national certified family life education option that some of our graduates pursue, and this basically certifies that you have education in 10 domains, including child development, human sexuality, family resource management, communication, family dynamics, and so forth, and also have gained some work experiences in the field. We also will talk about the infant mental health certificate in a moment, but that also can lead to state level endorsement. So there are some opportunities that our students can pursue, but they don't have to.
Okay, so a number of options once they get started. Now, getting into the program, obviously, there is no GRE or GMAT required here.
That's correct. For this
Okay.
applied master's, we do have a more research-based master's program that is intended to lead to our PhD, which we also offer. That does require the GRE, but for this applied human services master's, no entrance exams.
Okay. Well, let's talk a little bit more then about the specializations that are available. And of course, leading right up to that one that you just mentioned, infant mental health, which I know as a recruiter, I get a lot of excitement is generated when I start talking about that one. So go ahead and just start on with your specializations, if you would.
Well, that's one of the things that I think is most exciting about this master's program is that, often students have a certain career path in mind, and maybe that's being a parent educator for foster care families, or maybe it's being the director of United Way, and so with what we've done with this applied human services master's is offer students the option to specialize in a field that they're interested in. And actually it sounds like public health may be one that we could recommend to our students as well. We typically recommend that they look for graduate certificates that fit in an area that they're interested in, such as infant mental health or nonprofit management and developmental disabilities. But some students have a different idea in mind, and so we do work with students to kind of create this individualized plan if they need that.
So it can be pretty flexible. Again, like Dr. Hubach's program, it can go in a number of different directions depending upon where your passion and where your focus is.
Sure.
That's awesome. I know that as far as the program is concerned, the infant mental health certificate, which I was just saying, people get so excited about and so interested in. And again, it's no GRE, no GMAT to get into the certificate program, and they can be completed in just right around a year.
Right, and the nice thing about this certificate program is that it's embedded within the broader master's degree, so students can actually start in the certificate program, especially if they're not sure that they're interested in the full commitment for a master's degree. They can actually start with the certificate program, and if they get into it, they may decide that I can do this, I'm doing well, I want to take those additional 18 hours and obtain the master's degree, and then it's easy to make that transition.
And all those hours just roll right into that
Exactly.
the master's program. That really is a big help, because I know when I talk to people and they talk, well, I don't want to just do a certificate and then have to do an extra 2 years,
Right.
to get that master's degree.
Yes.
So, and I know enough about the HDFS program to know that you do have an undergrad HDFS program, which is perfect and leads right into it. But tell me a little bit more about the students that you're seeking for your program.
Sure. Well,
that are a good fit.
Yes. Well, as Dr. Hubach was saying, we do end up with a variety of students who come from different backgrounds, different institutions as undergrads. Most of our students are coming in with a social science background of some kind, whether that's HDFS or psychology, sociology. But we have some, who are coming to us from business who might want more of a nonprofit management orientation, and others who, maybe pursued an unrelated undergraduate degree, but ended up working in human services. And so they, now really want more of that education that's kind of supporting what they're already doing, and they want to enhance their careers in that way.
One of the ones that surprised me was talking to a couple of students, excuse me, prospective students that were interested in our programs here, but they were in early childhood development or early or elementary education, but they weren't really sure about becoming a teacher, but they knew that they wanted to run their own daycare systems or something along those lines. And I was surprised that this was actually a pretty good fit for them.
Sure. We do, as you can see, there's a lot of coursework around young children, and also the ability to take some courses in administration and management, which is offered through the Sphere School of Business. But I will say we also have teachers who are, in the public school system currently who opt to pursue this master's degree in applied human services, because often they feel that they already know how to teach, but maybe would like more information on how to work with families to promote child development.
Okay.
So, a really surprising number, I think, of our students actually are teachers who are coming back.
Very interesting.
Yeah, to pursue that. But we also have a number of grads who do end up directing or owning their own child care facilities. So around Tulsa, there are quite a few.
Fantastic. It's really great, really fun information, and especially as we followed up with Dr. Excuse me, I have a frog in my throat today. Followed up with Dr. Hubach and looking at the bigger community picture, and then looking at the smaller groups of people and how, it really does it ties it all together. So is there anything else that you would like to add about your programs? And I say programs as in multiple different options that you have available.
Nothing in particular. As we mentioned, we talked a lot about the applied program, but we do have our research programs so really we're here on the Tulsa campus all the way from the undergraduate degree through the PhD. So if anyone has any questions about the program we talked about today or the other programs, please don't hesitate to reach out.
Awesome. Well, there is Dr. Shreffler's information right there. Please do reach out, and you can also reach out to myself. Oh, sorry, I forgot to switch the slide for you. There is her information right there. So feel free to email her, or you can call us here at OSU Tulsa, and I will be happy to get you connected with her. And thank you so much for being here today and for everything that you're doing for our families. You bet. And with that, we go to kind of the next micro level of the same idea, and that is now we're looking at individuals who take care of the mindset of the individual, of those that go into the families, that go into the communities. And I welcome Dr. Tonya Hammer. Hi. Thank you. Welcome to the program. I said the program. I feel like Oprah sometimes up here.
Yes.
So tell us a little bit about your background, if you would, please, and then we'll get right into the counseling program, because I know our counseling program here at OSU Tulsa is a pretty popular one in the state. So.
Yeah, well, my background is such that I came not a counseling route. My undergrad degree is in English. I was a legal assistant for 20 years before going back to school. I started working and volunteering working with youth, and realized my English degree didn't really prepare me for that. So decided to go back to school and get my master's in counseling, went to a program that was there where I lived, fell in love with the field and work, and decided I also wanted to teach doing it. So then went on and got my doctorate in counselor education and supervision, and I've been teaching now I'm in my 11th year as faculty.
That's
so this
awesome.
was also just like Dr. Hubach, a change in careers for me.
I think many of us have.
Yeah. So,
many of us have.
Yeah.
So, I mean, from English to working with youth to deciding to go back and falling in love with the counseling field, what drove that passion? Why counseling for you? Because I hear this from a lot of different perspectives.
Well, the primary thing as far as his first doing it was when working with youth groups, of them establishing a relationship with adolescents is not always easy. And once you do build that rapport, they would come to me for help, for assistance. And it wasn't just, I had a fight with my mom last night, it's my dad's in jail and I'm now the head of the household and I don't know what to do. And I felt ill-equipped to really kind of help and to work through things with them. And so decided to go back to school just with the intent of getting better equipped to help those I was already volunteering and working with. And so then decided I want to do this other than just on a voluntary basis.
So then did you go into private practice for yourself or for an agency?
No, I've done, all through my doctoral program, I worked with an agency called Communities in Schools, which is a nonprofit that works within, contracts with school districts to go into the schools and be there to provide everything from kind of like human services, case management kind of stuff, to providing individual and group counseling. And so did that for years while I was in my doc program, and then did some contract therapy work, working with adults and everything else as I got out my doc program. But then primarily, other than some contract therapy work and things, I've been an educator. since
awesome.
then. So
I love how this is all tying together from what we're talking about now through the family structure with Karina and to the community structures with Dr. Hubach over there. And it's great. So let's talk a little bit more about the counseling program, because I do get a lot of requests for information about both our mental health and our school counseling programs. So take it away.
Our program, the way we always answer this question this way, in the sense that it is one program across 2 campuses,
Okay.
because our full program is offered both on the Tulsa campus and on the Stillwater campus. So you can take all of your classes on the Tulsa campus or all on the Stillwater. A number of our students take classes across both campuses. And we are primarily on the Tulsa campus. Our classes are primarily in the evenings.
Great.
Very much, we have a lot of non-traditional students who maybe are working full-time, have families that they're taking care of during the day or other things, and so they really appreciate that most of our classes start at 4:30, go from 4:30 to 7:10, 7:20 to 10 o'clock. And so that really is of benefit to those who are out working full-time.
Still working families and all of that. I know that personally, after having been in that field myself, that Oklahoma can be rather difficult as far as moving forward in licensure as well as accreditation and what they're looking for. Talk to us about KCREP.
Well, that's a whole other webinar. So KCREP is the primary accrediting body for master's level counseling programs right now in the U.S. It is the only accrediting body currently recognized by CHIA, which is the Council for Higher Education Accreditation. And when it comes to master's programs, both in just in counseling. There are other accrediting bodies for other types of counseling programs.
What does that mean, though, for an OSU student when they're looking for a counseling program somewhere in the country? Why is that important?
That sets a level as far as standards to make sure that your program is meeting the training you need to be able to go out and best serve those with individual counseling, group counseling. There are also some states, ours is not one, nor do I ever think that it will be, but there are some states that are pushing for the only way you can become licensed is if you graduated from a KCREP accredited program. There's also the fact that there are things like it's harder to get a counseling position with some government agencies like the VA if you didn't graduate from a KCREP accredited program. So it helps with markability. It also helps just with your training and that there are standards there. So when you come out of a KCREP accredited program, you're assured that your program has to have met certain standards.
Set the bar.
Yep.
Okay.
Yeah.
Tell me a little bit about what you mean by a practitioner model. Does it have to do with the program, the courses?
Yeah, our master's program we are not a program that emphasizes research. We are a program that emphasizes skills.
Okay.
And so preparing you to be a clinician when you graduate. If you want to become more involved in research, we provide those opportunities. So especially if students are wanting to go on and get their doctorate after they get their master's in counseling, and so they're wanting to go on and get a doctorate in clinical psych or counseling psych or counselor education and supervision, we provide opportunities for research, and we even have a thesis option that you can do. But the primary goal of our program is to provide you with the skills and training to become licensed and to go out and practice.
Exactly what you were looking for as an English working with juveniles.
Yeah.
Okay, I get that. So it looks like 100% of the graduates have passed the certification exam. That's pretty good boasting material right there.
We just started about 3 years ago where we became a provider for or a testing coordinator. The NCE is the National Counselor Exam that most states require for licensure, and Oklahoma is one of those. It's offered through the National Board for Certified Counselors, and so they provide us with our stats. And so our students have scored at 100% for the past 3 years on that. We do an NCE review for our students for free, of which there's a lot of places that will charge to do that, but I provide that for free for our students before they take the NCE exam. And so far, so good. We've had good success rates. So
that is fantastic. That, like I said, those are pretty good rates right there. As far as when they graduate and they go out to the workforce, what is the licensure? What kind of counselors are they becoming?
Primarily from our program, they're either becoming licensed professional counselors, as far as that's what it's called in the state of Oklahoma. That's a different title depending on your licensure board from state to state. But here it's licensed professional counselors, or we have the school counseling program as well. So they're becoming certified as school counselors. Okay. That's the two primary routes through our master's program. Unlike Dr. Shreffler or Karina's program that offers a marriage and family masters, which are becoming LMFTs, our program is not set up to where they can meet the requirements for an LMFT licensure because there's different practicum requirements and internship and things. And so the route when you go through our program is primarily directing you towards LPC or school counseling.
Okay, so very, very individualized, focused on the person that you are working with as a client.
We also talk systemic, and they take a marriage and family class and those kind of things, but you are not in a position when you graduate from our program to become an LMFT, because there's a lot more emphasis on that in an LMFT program than there is in ours. But because we have underlying a lot of our work, you talked earlier with Dr. Hubach about social justice.
Right.
The social justice and diversity is a large part of our mission and our goals within both our master's program, which is offered on this campus in Stillwater, and our counseling psych doc program, which is offered in Stillwater. Social justice is a primary kind of focus for us, and it's really hard to be about social justice without looking at things from a systemic lens as well. So we do emphasize that within our program, but as far as having the necessary requirements and everything else to be able to become an LMFT, that's not where we're going. So the LPC is focused more on making sure you are there to do individual and group work, and you can also work with couples and families, but you don't have the extra training in that area for the licensure.
Right.
Yeah.
Okay. Well, tell me a little bit more about the program itself. You know, what's required, the GRE, the MAT. How many hours, so on and so forth.
Our mental health counseling program is a 60-hour program. We just revised our plan of study for that, or the degree requirements, to where it is, in the past it's been where you were able to take one elective along with basically 57 hours of required for the mental health. We now, our students have revised it for they'll be able to take 2 electives, allowing them to have a little bit of an emphasis. Maybe they're interested in an area of working with children and adolescents, so they could take the Foundations of Play Therapy course and Child and Adolescent Counseling to go towards that specialization. Our school counseling program is 57 credit hours, which is above what's required as far as for school counselor certification, but it provides you, I think, with even more training that makes you better equipped to be an effective school counselor than taking the bare minimum that's required for certification.
So with that being said, you know, when you talk about being better equipped and the type of counselor that you're producing from the program, who's coming in? Who's your ideal student? You have a lot of inquiries.
I mean, you look at me. I came in with an undergraduate degree in English. We have students coming in, yes, with backgrounds in psychology, sociology, behavioral health, maybe a bachelor's in social work. But we also have people in our program who are coming in with a master's in theology, master's in engineering. We've got one right now that has a doctorate in bio something. I'm not a biologist or anything. But it's a variety. A lot of our school counseling are coming in with teaching backgrounds.
Okay.
Not all, but a lot of them are. But you have no degree, no specific degree is required, and no degree would limit you from coming into the program. It's a desire and passion to work in the field of mental health, and that's what you need.
Is it a competitive program?
Yes, I think it very much is within the state of Oklahoma. It's we have a number of applicants for our program, as well as it is a program that we have people applying for, not just from the Tulsa and Oklahoma area, but also from out of state. We have some international students And so from a variety of areas.
It looks like we had a question come in from one of our viewers, and Jamie's asking, is the GRE or the MAT, is there a waiver that's available?
No, there's not.
They are required.
They are required. One of them is required.
Okay, yeah, not both, but,
Not both,
but at least
one of them is required. It is not a, it's not the only thing we take into consideration or consider. We consider the whole application. So that application involves recommendation letters, a personal statement,
Right.
as well as your GPAs and your GRE or your.
You're looking at that whole person.
Yeah, we're
right?
looking at the whole person.
So even though, as I had another question come in earlier this week in preparation for your being here, it was pretty much based on the same thing. So if they even already have a doctorate or another master's degree, they still have to take it.
They still do. Yeah.
Okay. Are there any other prerequisites that are required?
No.
No, obviously with all the different types of
Degrees come in.
degrees.
I mean, there's a possibility, if at least if taking an intro to psych class will help you.
Mhm.
When you get into like the human development class, or you get into multicultural class that maybe is using terminology or things that you would have learned in an intro to psych class, but it's not absolutely necessary, nor does it mean that you are not going to do as well in the program just because you don't have that background.
Is there anything else that you can tell our prospective students out there that you would recommend, or maybe to take a look at, as far as, their academic career in pursuing this? Because this is a pretty important, as all of these programs that we've discussed today are very, very important. But when you're working directly with individuals, is there a special skill?
I think the main thing is a desire to help people. I think one of the things I would recommend is doing some volunteer work in the area of working with underserved populations, of working to where you're honing the ability to be able to actually really listen to people. We think we're good listeners until we start getting into a basic counseling skills class or something where you're talking about active listening, to where you're really sitting and you are really listening to the person, not preparing your answer for them as they're talking.
Oh yeah, talk to people. No.
Yeah.
It sounds, with all three of you and our guests today, I appreciate so much, because it shows each different level on the same thing, and that is, humanity and social justice, and helping each other to become better individuals, better families, and better societies. So.
And I think I agree, and I think that one of the things that's really kind of represented out of that as well is the fact that we all, from the three of us, from the programs that we're in, and just as individuals as well, we all talk about opportunities to collaborate, and we've done work together and different things, and it's because we all have that goal and the passion in mind of helping to make our communities and our society and everything else better. And we need to do that on an individual level, a systemic level, a policy level. And
Absolutely.
So it takes all of us working together to do that.
And everybody covering each one of those different levels with the same amount of passion.
Exactly.
Thank you so much, Dr. Hammer, for being with
you.
us today. We really appreciate it, and I look forward to working with all of you in the future in helping to develop more really good community people and family members, and especially individuals. So I thank you very much for your work and all that you have put into it.
Well,
so
thank you.
For some more. Thank you. We have just a couple minutes today. Actually, let me just go ahead and kind of close this one out. You have Dr. Hammer's information right there, and how to get into one of these programs, of course, is to request the program information, and you can do that, by just contacting us right here at OSU in Tulsa. You can contact the Graduate Student Services Center and pretty much get with me, and I will connect you with one of these program coordinators or one of your faculty members who will help you to the next level. And also, just as Dr. Hammer was mentioning, he's preparing those application materials. We have a career center that can help you write a personal statement, help you perfect that resume, and get all of those things put together that you need to have your application looking as good as possible. And then just submit it. And submitting that application is as easy as going online to do so. If you are needing or interested in any funding, be sure to submit your FAFSA and with our school code. And with that being said, I want to go to kind of one more thing. There's our contact information so that you can reach out to us so that we can send you that information or ask any more questions. And please feel free to send us in your questions now, and I will forward those questions on to our guests today. Or, you know, whatever we can do to help you get started in that right direction. I have one more guest that deserves an honorable mention today, and as we've been talking about mental health, community health, family health, one of the things that I know a lot of places, including our own Tulsa airport, has started to use lately, and that is pet therapy programs. And providing that pet therapy, especially, you know, petting a dog, there's nothing that is better for reducing your stress, bringing a smile to your face, helping someone out who is in trouble or in stress or having, you know, suffered a traumatic experience. And I think I have some assistance here with our, if you lose me on this camera, please do tune in on Facebook, and I'll bring him right over here because we have a special guest joining us today. He's asleep. Wake up. Come here, buddy. Look, we're dragging a chair. One more thing on the Pet Posse program. OSU, on all of our campuses, we actually have a pet therapy program to help all of our faculty, staff, and students get through finals, get through unfortunate events, and, you know, loss of family members, or just to brighten their day. So with this being a really good opportunity talking about mental health programs, to introduce one of my favorites. Sonny, come. Turn around here. Can you sit? I know that some of you know him, and some of you have seen him recently on our promos for our for these grad chats. And like I said, his name is Sonny, and his favorite name is Sunshine, and he just tried to sit in my lap. He's 100 pounds of lap dog. But he's getting pretty popular around campus because this is what he does. He comes and he sits with you and he lets you pet on him and he loves and he gives you big hugs, and he is just a blessing to have on campus as well as in my own home. He has provided a lot of therapy for a lot of people so far, and he's only been in the program for about a year. So as you see, there are so many levels of, health, you know, whether it is community health, family health, individual health, mental health, even pet health. So thank you again for tuning in to our grad chats. Be sure and join us for our next and last one next Tuesday at noon as usual, and we will be discussing education programs. And call us if you have any questions. Thanks again.